At UPMC's Rehabilitation Institute in Williamsport, Adam Ridgedale is an orthopedic clinical specialist physical therapist who sees many patients with different spinal conditions. Ridgedale says physical therapists treat a broad category of spinal conditions that fall under what is known as mechanical back or neck pain. He says this is present whenever pain responds to any type of movement or changes in positions that will either increase or decrease symptoms.
That could include muscles, ligaments, bones, joints, nerves. And there are many common spinal conditions, oftentimes provided by medical providers, such as our physicians or PAs, that would fall under this bucket. And most people are familiar with them, and they would include things like sprains or strains, radiculopathy, bulging discs.
Ridgedale says as far as techniques he uses on those with back pain, it varies based on the patient. He says the cornerstone of physical therapy and the interventions they provide is first and foremost patient education, which is important because patients should understand why they are in pain and what they can do. Ridgedale says as therapists, they will create a tailored program that addresses the deficits as it relates to their movement and function. He says a lot of time that can be weakness, reduced mobility, and flexibility issues.
We do some techniques that are considered manual therapy techniques, and they can include things like soft tissue mobilization to try to reduce restriction in tissues like muscles and the connective tissue that exists in those areas and under our skin. Um, and we also do joint mobilizations.
Ridgedale says other modalities like hot and cold packs and electrical stimulation are used in instances where they need some help in trying to control the patient's pain. He says when they do these exercises and manual interventions, they try to dosage them in a way that is well tolerated, but oftentimes patients are in a sensitive state.
As far as lifestyle modifications go, I think modifications that would kind of affect or be applicable to overall health, and that would be maintaining a healthy, well-balanced diet and regular exercise and activity. And of course, individuals, should consult with their physicians to make sure that that is safe for them when it comes to exercise.
Ridgedale says he and other therapists work with patients across the spectrum of timing as far as in their experience and journey with pain. He says surgery should preferably be avoided if at all possible. But if surgery is necessary, physical therapists still have an important role in preparing patients through education.
Eventually, they come to my care, an outpatient, and it's where we basically take them from that baseline of in those postoperative days and basically work at restoring mobility and function, and then with the goal in mind of restoring them to their prior level of function and maximizing their overall functional capacity.
For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.